I've made a rightful mess. Hello equestrian friends, and welcome to my version, or a registered nurse's version, of what you should pack in your first aid kit. I kinda gotta stretch to get started on this big mess. This used to be my first aid bag. It's the old bag that I had. You don't need a fancy bag. Don't waste your money on a $120 first aid kit just for the fancy bag. You don't need it. A lot of these supplies you can get for a fraction of the cost of what a first aid kit costs. Although if you can spend the money on a first aid kit that's already prepared, have at it. But for years I just used this bag right here. The only problem with it is you had all of this crap stuffed in it and you couldn't see what was what, and it took a while to find something, and if you have a true emergency, that kind of poses a problem. So we're going to chunk that old bag, and this is actually a cosmetic bag I bought on Amazon for 18 bucks. I like it because it's got clear packaging. You can hang it on a stall if you're working on a horse. It's got several compartments, so you can put designated things in specific compartments and actually be able to see what you put in there. That worked out a lot better in an emergency situation than this bag where you couldn't see what was what. I don't even know where to begin. Oh no, I got a lot of crap. Let's begin with medications that you should have. Let's start there. Medicines that you absolutely should have as a horse owner you can get from your vet is, in my opinion, injectable Banamine. Paste Banamine is great, but if you have a horse that's colicky, first you want to give it some pain relief so it's not rolling all over the floor on you. I think everybody should learn how to give an IUD injection of medication. Banamine you can put in the muscle, but there's been rare instances where horses get some kind of necrotic tissue disease in the muscle where they've had Banamine injected. I'm not exactly sure why that happens, but you can Google it. But IV Banamine works quickly, especially with colic cases where you need pain medication on board fairly quickly. So ask your vet to show you how to give IV Banamine. I also have a video a while back instructing you on how to give IV medication, but I think every horse owner should know how to give an IV shot. This is Butte. It's not really a must-have, but it's a nice-to-have. It's kind of anti-inflammatory for horses, so if you have a horse with an abscess or some sort of minor injury or inflammation and you want to give them an anti-inflammatory, Butte is great. These two you have to get from the vet. All of this other stuff is over-the-counter stuff. This is actually lidocaine cream to kind of help with pain on minor cuts and scrapes and stuff. That's not really a must-have, but it's a nice-to-have. This is eye ointment. It's triple antibiotic eye ointment. You can actually get this at Tractor Supply, that kind of thing. It's not dangerous to put in a horse's eye if you think that they're having eye issues before the vet can come and see them. The one that is dangerous to put in a horse's eye is the kind that has a steroid in it. You have to get that from a veterinarian. So when in doubt, call your vet, always call your vet, and you can always put this over-the-counter triple antibiotic eye ointment in their eye and it won't cause a problem. If you happen to have the one that has cortisone in it, which is a steroid, do not put that in your horse's eye until the vet has come to see it, because that can cause, if they have a certain eye ulcer, it can cause it not to heal as well. So that's a good thing to have in your kit. In regards of talking about the eye, this is another thing you can get. You can get from your vet. These are little strips that dye the eye, so you can see if they have an abrasion or a cut, or like something has actually broken the surface of the eye. It will take up stain. So that's another thing that you can do while you're waiting on your vet to see exactly what's going on with your horse's eye. I had a horse that had a lot of eye problems. He had uveitis, so I'm a little bit not an expert, but I know a good bit about horses' eyes, and my vet instructed me on how to use those. This is just regular old Neosporin. And then cleaning solution wise, I have a bunch. So I have regular betadine, which is a little caustic, but a necessity if you need it. And then I also have, these are little betadine swabs that I got from work. But they come in like a swab. I also have little alcohol swabs. I have little alcohol wipes. You can get alcohol wipes at your local drugstore. It's easier to have to give a shot with than like liquid alcohol would be kind of heavy. So I have that. I have hand wipes for your hands to clean. Where's the chlorhexidine? I also have chlorhexidine. Chlorhexidine is a good cleaning agent to have. You can get them in these little pre-made sticks. I might have used all the ones that I did have that I got from work. But chlorhexidine is not as caustic as iodine is, so that's a good cleaning agent to have. These are little sterile saline flushes. Again, I got these from work. But you can get sterile saline from like Tractor Supply, that kind of thing. If you have a fresh cut, one of the best things to do is flush it with sterile saline, and that way it'll flush out the debris and stuff, and it's not as caustic as like flushing it with betadine or chlorhexidine or that kind of thing. So that's a good thing to have, is some kind of saline flush, sterile flush, not old nasty dirty water that you found in a creek bed. You know, you want to use a sterile flush to flush out any debris from a wound. I just keep rambling on and on and on. Oh wait, I got more medications. Ah, yes. Okay, this is not a necessity, but it is something that is useful to have. The veterinarian actually gave me this, and then I got some of it from work. But it's dexamethasone. It is a injectable steroid. When my pony got a snake bite, it was a really sad day, and I don't really want to go there, but you can go back and watch on things to prevent snake bites. But anyway, when he got a snake bite, it was really imperative to get some of these fast-acting steroids in him to help prevent the very quick inflammation that was happening. So if you suspect your horse has been bitten by a snake and their airway is starting to close up, then this would be helpful to have on hand to give as an IV shot. Again, it's very useful to know how to give an IV shot, and your vet can tell you how to dose that. So that's something that I also carry in my emergency kit. We'll pause there, and I'm going to find a place to put all of this junk before we move on. Side note on these, you want to store these strips in a place where they cannot get wet. I'm actually going to pack them up. This is just a little, I don't even know what this was from. I think it was a little container my vet gave me when they gave me the eye ointment stuff. So I'm just going to, oh, there's more eye ointment, look. I'm going to pack all these in here so that if this bag ever gets wet, it won't destroy all of my fluorescent strips. That's what they're called. Okay, I have found a home for all of those things. Now let's go through all this other stuff. The rest of this stuff is kind of wound care and also syringes for giving your horse a shot. Let's see, I got a bunch of, look like a drug dealer with all these syringes and needles. Ooh. Okay, let me see what all I got here. So, I got your 3cc syringes, I got some 6cc syringes, I got some 10cc syringes. It's good to have a little combination of them. The Banamine will go in either a 5 or a 10cc syringe, but the dexamethasone will go into smaller syringes. So it's good to have a little variety, like a couple 10cc's, a couple 5cc's, and a couple 3cc's is great. So I have a nice little variety of syringes there. I might put, let's see. I might put all of my syringes in their own bag. and have just like a syringe bag so those don't get so confusing. I just kind of had syringes here, there, and everywhere. So there we go. Again, you can get all of this at like your feed store or Tractor Supply, or your vet can provide you with some syringes. And then when you have syringes, of course you need needles. Some syringes come with the needle. Little nurse pro tip is when you're pulling up medicine to inject, switch out the needle, because when you put the needle through the stopper, it blunts the tip of the needle, and then if you use that same needle to inject, it actually is more blunted, so it doesn't pierce the skin as well as if you would have used a fresh needle. It's easier, especially if you have a wiggly horse and you need to get an IV shot. You get a more precise shot instead of like it didn't go through, and then you kind of wasted time. So switch out your needles. It's also more sanitary that way. Anyway, I have a variety of needles. These are 22 gauges. These are blunt tip 18 gauges. The larger the gauge, the smaller the number. So an 18 gauge is actually larger than a 22 gauge. The blunt tip works great at drawing up your medication, and it's a larger diameter, so it's easier to draw stuff up than a teeny tiny diameter. So if you're trying to draw up a medication and it's taking forever to draw up, you're probably using like a 23 or a 25 gauge, which is a really small hole. So it's hard to pull stuff through. So get yourself a few 18 gauges to pull the medicine up with, and then you can use the smaller needles to actually give the medication. You can ask your vet what all size gauges you need. You can get all different size gauges and lengths of needles at Tractor Supply or from your vet. So I have kind of a combination of a 22 gauge would be like something you would give under, like giving a dog a shot like under their skin. The 20 gauge and the 18 gauge are pretty good at giving IV medications to horses. And then I would suggest having at least a 1 inch to 1.5 inch needle. Again, this is not a necessity, it's just something that I've gotten from work that was going to be thrown away anyway. But this is just a set of needles with thread if I were to need to put in a few stitches. I know how to do this. I've been trained to do this because I'm in advanced practice nursing school. I'm going to CRNA school, nurse anesthesia school, and we are taught how to put stitches in, to sew in central lines and that kind of thing. So I actually know how to put stitches in. If you do not know how to put stitches in, this is totally useless. You do not need this. This stuff is called Surgisil, and it's a cool little thing. It is very expensive. You probably can't find it, but what it does is it's like a gauze that you can put on a wound and then wrap it tightly, and it kind of helps the wound clot. So that's what that is. Your basic things that you need is either these are sponges, which are very absorbent and work really well if you're having a big bleeding situation, and you can make a nice pressure dressing with those, or just regular gauze. So I suggest going and getting a big pack of gauze or sponges, abdominal laps, that kind of thing is what they call them. So all of this stuff is just gauze, and then you need something to be able to wrap it in. So get you some Ace bandage from Walmart. There's 3 freaking thermometers. Anybody need a thermometer? But a polo wrap, if you're in dire need and don't have any other thing to wrap with, would work good too. But this is cool stuff. It's called pressure dressing. I don't know if you can find this at the store, but if you can, I suggest getting it. But it's this kind of foam tape. It's tape on one side, but it stretches, and you can actually stretch it and put some pressure on it if you're I advise caution with this when using on horses' legs, because you can definitely damage tendons by putting that much pressure on tendons. But if it's a situation where the horse is bleeding out, by all means do some sort of pressure dressing. And by doing a pressure dressing, I mean put nice absorbent thick wad of gauze on it and wrap it as tight as you possibly can, and actually put manual pressure on it with your hands. I have just other random tape. that might be useful for taping gauze on humans, or this probably won't stick to hair, but maybe if you need to tape a dressing to a horse. This is Metapore tape, and then I have silk tape. So get some tape, get an ace bandage, get you some gauze. Those are your bare necessities you need in a wound type situation. I highly suggest having a thermometer. You don't have to have 3 thermometers, but 1 thermometer will do. Some gloves, so I have a little packet of gloves here. These are totally extra and not a necessity. This is called Zero Form gauze, or petroleum gauze. It's actually gauze that's soaked in petroleum, so they're kind of like moist. If you're having to do a wet to dry dressing, this is not really for emergency, but for like wound maintenance, these are great to have. It keeps the wound bed moist to aid in healing and that kind of thing. And then these little guys, I actually got from my dad, but you might could find them from your vet or over the counter. But these are skin stitches, so it's basically just, probably really just super glue, but it's like skin adhesive. If you have a minor cut, clean it first with sterile saline and probably some chlorhexidine and let it dry, and then you can use this to put over small cuts. It won't do a big gaping cut, but over small cuts to help seal the wound from stuff getting inside of it. So that's a cool little thing to have. This is just KY jelly. You don't need it at all. It's just, these come in little prepackaged things that get thrown away at work, so I grabbed them. But you could lube up your thermometer before shoving it up your horses. These little guys aren't for horses. It's a tegaderm dressing. It's like a clear Band-Aid. It's kind of large. It's for people. So these won't work on horses, but it's kind of a nice sturdy Band-Aid for people. They're expensive, so just get regular Band-Aids or gauze and tape for human wounds. Oh, speaking of human necessities as well, I'm sorry. These are just little packets of Tylenol and Benadryl. Also, if you have anaphylactic reactions to things, then I suggest that you get an EpiPen and keep that in your first aid kit as well. But I also carry a pretty sturdy knife in case I need to cut anything. Say something got stuck on my horse or whatever, or I need to cut a piece of tack, I don't know. If you need to cut something, it's good to have a good sturdy knife with you. And then also a lighter. I don't really know why you would need it, but you never know. I don't know. Maybe you gotta burn something off. Ooh, ticks! Burn a tick off. So that is a nurse's first aid kit in a nutshell. Oh, you're probably wondering what this is. I just keep this in my first aid kit, but it's just replacement CO2 cartridges for my air vest. I highly recommend keeping a first aid kit in a readily accessible area, but if you're having these medications in your first aid kit, you need to keep it somewhere where it's air conditioned. Today it's 103 degrees outside, and the stuff would spoil if I was keeping it in the barn. So I keep it in the house. It's readily available for me to go and grab if I need it. And I keep my trailer keys, the way that I remember to grab it is I keep my trailer keys inside the bag, so I have to grab it to get inside the trailer. So that's how that works. But anyway, these CO2 cartridges don't need to be out in the heat either, so I keep it in my first aid kit. You also need to get yourself a set of tweezers and a set of scissors. That's it. Thank you guys so much for watching. Comment down below, let me know what you guys put in your first aid kits and any recommendations you might have. This makes a good bongo. Yeah. So I hope you enjoyed. Please please like, share, comment, subscribe, do all the things that help me out. I'd appreciate it. And I'll see you guys next time. I'm getting some DIY videos in the works, so please stay tuned. I promise I'm going to make one that shows you how to make jump cups very soon. I know everybody has been asking for that. But that's all I got for you guys. Thank you guys so much for watching. Love you. Bye. Mwah!